are the layers of your skin. You have your epidermal layers, which are your surface layers. You have your dermal layer, which is like the middle living layer of your skin. And then you have your fat layer, basically. So when we're looking at the difference between a cosmetic moisturizer, so a high street moisturizer, compared with something like a cosmeceutical or a medical grade, what we call hydrator, these moisturizers are sitting on top of the skin. They make the top of the skin feel lovely. You get that instant hydration, but that's as far as they're going. So when we're looking at your high street moisturizers, they focus much more on, does it feel nice? Does it smell nice? Does it look nice? Does it have a pretty packaging? Does it have some good celebrity endorsements? All of these things before they're actually focusing on what are the active ingredients in it and how far is it going to get within the skin. So your cosmetic moisturizers, they feel lovely as soon as you put them on top of your face, but that is as far as they are going. And there's a couple of issues with that. If you have lots and lots of moisture on top of your face, your skin is really clever, and it sends messages to those deeper layers of the skin to say, oh, I'm saturated, I don't need any more moisture. So the only layer that's being hydrated is the surface dead layer. That layer doesn't need any moisture. Absolutely not. Like, it's dead skin. We want to be getting rid of it. The layers that we actually want to be hydrating are these deeper dermal layers, because that's where you make natural hydration. So if you're applying a moisturizer daily, then your skin essentially gets lazy and essentially becomes like addicted to the moisturizer. Now, there's a really easy way to tell if this has happened to your skin. If when you get out of the shower, if your skin feels tight until you put a moisturizer on it, that is a typical telltale sign that your skin has become addicted to that moisturizer and it's relying on it to hydrate it, but all it's doing is hydrating that dead skin layer. All those layers underneath are going to get dehydrated, which is not a good thing, because the living layer is the layer that we actually want hydration to be in.